All right, Sean, right here for Digital Muscle. I'm joined by the good doctor, Dr. Morales, a classic physique professional and also a highly trained surgeon. Is plastic surgery? That's a specialty? How do you go from bodybuilding and fitness into plastic surgery? Let's take one thing at a time. First of all, we're here in Houston, Texas, I might add. Pro Classic Physique athlete. Take us to the beginning of that journey.
Well, as a plastic surgeon, I mean, that's what I want to do since, childhood. I want to be a plastic surgeon. So that's kind of where I went. And then once I got into my professional career, actually doing what I wanted to do, in private practice, we got a little bit more flexible in our lifestyle as far as being able to exercise. My wife and I have always been exercise every day.
And your wife's a pro figure competitor?
Pro figure competitor.
Okay, Corey Morales.
Yeah, Corey Morales. We both turned pro together.
Wow.
At the Universal Championships.
And when was that?
2019.
Okay.
2019. We did it together, same show.
Nice.
It was one of those miracle kind of events. So it was really, really fun.
Yeah, two totally different disciplines.
Totally. Right?
How was it like dieting and training in the house? And is it easier together?
I think it's easier. If you ask my wife, she'll tell you the same thing.
Yeah.
But you kind of suffer together. We eat the same food. We train about the same time. We would train early in the morning, like 4 o'clock in the morning. My routine, these guys have seen this routine, but it's down to the minute.
Yeah.
You just gotta stay disciplined, and that's what I really enjoy about bodybuilding. It's just the discipline it takes and sculpting your body into physique that you can attain. It's attainable.
Right. I imagine a lot of that carried over into the medical practice that you have, the discipline we're talking about, and the precision.
Absolutely.
And the patience to make it through the med school, then to be an understudy, and then to be working with other doctors in this nice clinic we have here in Houston. Take me through how the two work in synchronicity. How is the discipline of the sport of bodybuilding and fitness work in concert with coming in to see patients where you've got to be hygienically clean and spot on every day?
Sure. I mean, my day job is a plastic surgeon. That's what I do every day.
Yeah.
And bodybuilding has just been a hobby for me personally that has a lot of similar qualities and demands mentally as well as physically to be a good bodybuilder. So for me, the discipline, what it takes for me to operate on a patient, right? And the level of aesthetics and like the aesthetic eye that's required for me, what I do specifically.
Yeah.
I can be more critical of my body. I know what little things are going to happen. I do this is going to be the consequence. How can I sculpt this versus that? And I was able to I felt like I was able to really kind of use the foundation of being a plastic surgeon and then incorporating the bodybuilding. It was a seamless transition.
Yeah.
So and then helped my wife, I think, she was, kind of helped her with the discipline and, vice versa. She's definitely mentally stronger than I am, but to be inspired by her, just her hard work, she works really, really hard.
So how are you approaching your diet and your training? Because for me, I was one of the fortunate ones that it was very instinctive. I wasn't a big reader. I didn't read the science of bodybuilding. I didn't learn how many calories I needed to eat or how many grams of protein or carbs are in certain things. It was very organic for me. I was
really
one of those athletes that, I just cut my carbs, increase my cardio, and I start to lean out. Train a little harder, eat a little bit more, and I got bigger. But I was never very scientific. You, as a doctor, strike me as somebody that's like, gotta have 24 grams of this and 2 grams of that, and all that stuff. Are you very scientific?
I was when I first started. I was very precise. My head was kind of getting in the way, and then I realized quickly that, I leaned to the experts who coach, athletes, and that's what I ended up finding. I found my coach, and I was like, "You tell me what to do."
Yeah.
And that took all the stress away from me because I didn't have to overthink it anymore. I just trusted him. He's a professional 212 pro.
Your profession is the plastic surgery. Let's be more specific on what that entails, because like when I see the shows on TV, I see eye surgery, I see rhinoplasty and the breast augmentation. Tell me some of the things you specialize in.
So I'm an aesthetic plastic surgeon. This is all I do. I've been trained as reconstructive surgery, which is reconstructing every part of the human body actually. I've touched everything. But I don't do that. Really, my specialty is aesthetic surgery, so to make people feel and look better about themselves.
Right.
One of my specialties within aesthetic surgery is working with athletes, specifically athletes from bodybuilding to CrossFit to yoga. I think I understand them a little bit better, like the need to get back in the gym, the mental requirement to be exercising and live healthier, right?
Right.
So for me, I focus mostly on breast and body. Commonly for women, I would say 95% of my practice is women.
Okay.
5% is men. Men do have issues that need to be addressed. Either it's extra skin in the lower abdomen, or some guys have a little extra gland tissue on stage. It looks terrible, and they're going to get loose points in judging sometimes. Right. I can do that. I can cure that surgically. For women, there's some deflation associated to breasts. So implants are often requested. Some shape changing of the breast from the sagging of pregnancies. We can rejuvenate the shape, rejuvenate the abdomen with extra skin and just stretch down muscles. I can fix that.
What is the advantage? Like, I get it that the athletes, because when I came up in the 80s, most of the girls didn't have breast implants. It wasn't a thing. And nobody made a beef about it. So what is the advantage psychologically to some of these ladies that you enhance them? How they leave you and how they come back around to you?
I think it's more of a psychological reason, right? You know, it's all about, feeling better about yourself. It's all about self-confidence.
Right.
That's all there is to it. That's what comes down to self-confidence. Is to have more of a self-confidence on stage. They feel more proportionate because they're full-breasted. Women. A lot of women on stage right now have augmentations because they're doing it for multiple shows and they've dieted down. They lose all their breast tissue and they feel like having some more fullness, accentuates some of their curves, right?
Right.
And that's kind of where it comes to specific bodybuilding.
And the way the clothes fit, self-esteem. Right. I'm not an expert, but there's like saline and then there's another one, silicone.
Silicone, that's right.
Is the silicone a thing that's like bad? I've heard both. I've heard some girls had issues with, not with saline, but maybe had issues with silicone. Is one better than the other? Or is it
I would say the
preference?
majority of implants that we're doing for augmentation in the United States specifically is going to be a silicone product. It's going to be softer, it's going to be fuller, there's less rippling that you see on
the rippling is what problem a lot of girls had in the past.
Very, very, very common with saline implants. That was a big problem. So, those patients who've had saline implants are coming back, and we're doing implant. I saw one today. We're gonna change our saline implants. It's kind of upgrade to a silicone product. It'll be a much smoother contour of her breast. She'll look better in a bikini. She'll look, better in the nude. And be softer. And look even a little more natural appearing. For those that are
entertaining the idea of possibly doing that, like, what's the process time from start to finish, from the consultation to I can go back in the gym for a breast job? How long is that process?
I mean, once you have surgery, for me in my hands, the surgery lasts about 35-40 minutes.
Okay.
And then you were going to crib you for like another 45 minutes. You go home. Usually by the afternoon, most people are eating like a light lunch and having a decent dinner. They take pain medicines maybe 3 to 5 days. For my athletes specifically, or just regular people, I have my patients back in the gym at week 3.
Oh, that's pretty good.
So we're doing cardio. We talk about cardio. We talk about weight training. They're restricted, but I have a whole list of things that I've been experienced with working with athletes.
Well, I mean, I don't think people really complain about the ladies in bikinis with boob jobs. It's almost acceptable because it actually accentuates the femininity. So you're not going to get a lot of complaints, especially from the men. And most women admire a nice job. But what's becoming more and more popular are the butt implants. This is something that I'm starting to see with more frequency, not just in bodybuilding. I see it around the world. And what stands out is the bad ones, right? So because it's so noticeable. Is there some hazards to doing that? I mean, is there some hazards and benefits to doing butt jobs for certain individuals?
So doing a butt augmentation in athletes, I do not recommend.
Because?
They're just too lean.
Yeah.
They're too lean. They don't have enough body fat to camouflage an implant. So when you get in body fat, sub 10%, you really don't have a lot of fat tissue to camouflage any implant. That's on your breast, and also especially on the butt.
Okay.
So I'm not I have a bodybuilder who comes to me for butt implants, and they're actively competing. My answer is no.
Okay, yeah.
I will not do it.
There's got to be a moment where you're almost a psychologist too, because I'm sure you probably had to tell somebody, look, no, I don't think it's a good idea for you to do something like this. How psychological is it when people come to see you? That they think they want something, but you as a doctor is like, it's not something you really need. You ever tell these guys no?
It happens all the time.
Yeah.
For me, I'm here to help you. And if you're doing something I think it's not gonna help you, you don't need it, I'll straight up tell you don't need it.
Yeah.
I'm very real with my patients. I'm here to make money. I'm here to help them look and feel better about themselves.
So do you think it's a good mix because you're in the body business and it transfers in here? Because I've seen a lot of doctors that don't look like you and they don't take care of themselves, but they're great at what they do, and they are busy making a living. But for you, it seems like it goes hand in hand. It complements it very well, and your wife probably keeps that balance.
Absolutely.
What do you think would be harder in terms of the goal? Like, let's say that it was in your mind that you want to be the Classic Physique Olympia champion, which is hard. It's almost like a full-time job.
It is.
I gotta say, being a doctor's got to be harder than that, because I've already done the bodybuilding part, and I can do that in my sleep. But being a doctor, you got to retain so much information.
Yeah, and it's a 24/7 job. I'm thinking about my patients all the time. I mean, it's something that if I'm thinking about a surgery and I'm trying to figure out what I'm going to do, because every patient's unique.
Right.
I'm studying their photos a day before, looking at their pictures, making sure I have a plan in my head. So
you're doing all this while you're dieting and training for shows.
Yeah.
That makes it even more.
But you know, I've practiced. You know, just like posing, right? You practice, you practicing your high head, and practicing the car. You're thinking about the tempo, and you know what I'm talking about.
Right.
Same thing for surgery. I'm practicing the surgery, but before I even get to that surgery, I've already done it 4 or 5 times on my head.
Yeah. And so, do you think it was easier?
Kind of doing it.
Think it was easier getting ready for the show with your wife, or do you think it would be easier? Like she was not on the same diet prep as you. Like when you do it again for your next show, would you want to do it again with her?
We've had this discussion already. My request is I do it with her. If I'm gonna do a show, I'm gonna do it with her. I just find it's easier for me, as far as with foods around me, and then you know she inspires me. Like she does not mess around. So I'm able to kind of stay more disciplined, even though I'm fairly disciplined. She's extremely disciplined, and so she kind of makes sure I don't fall.
You had one of your, I would imagine it was a little bit of your dream this year. You sponsored the Olympia. You're on stage. You handed Chris Bumstead his Olympia award. How was that? And your wife was right on stage with you. How was that for you?
You know what I mean? That's a bucket list, man.
Yeah.
I mean, just to be on that Olympia stage, we're such fans of the sport, and to come in at a time of the sport where it's just so it's been such a challenging year.
Yes.
And then be given the opportunity to be on stage and support the athletes and support the sport of bodybuilding. It's such a hard time right now. It was just such a privilege and an honor, and I really hope to continue to be part of the industry and continue to promote the sport and be an ambassador for health and fitness. And you know, it's just a fantastic sport. I think it inspires a lot of people. A lot of people are not bodybuilders, and they see me or they see my wife, and they're like, wow, you really inspired me to go work out, right? Get up and exercise.
You're the embodiment of the whole picture, especially if someone walks in the door and they actually see you and hear your story. So when you are out there, are you able to just be normal, or is everything about medical questions? I have a million more questions for you on the medical side, but as a bodybuilder, people come to me and they're asking me all these bodybuilding. How many calories should I eat? How much protein? And it's all bodybuilding all the time. This is a different thing for you because you're not done with your patient when they walk out the door. There's follow-up.
Absolutely.
And then you still got the incoming patients.
Correct.
And then you got to budget your time to get in the kitchen and cook your food, eat your food, go to the gym. I imagine the gym's got to be therapy for you on some level.
That's my church.
Yeah. And so there's got to be that time where you block out the rest of the world and have your you time. But is the phone ringing from patients? Hey, you know, I'm feeling this or I'm not feeling that.
I have a great team. I kind of have my own personal team that helps me, you know, handle just the simple questions.
Yeah.
I'm available 24/7, literally 24/7 for my patients. They have an issue at 5 o'clock at night, my phone rings, and I call them. They're like, I thought I was talking to nurse. No, you talk to me. That's my job. I take it very personally.
What's the next bucket list thing that you have? I mean, it seems like you have it all already, but you've worked long and hard to get to where you're at. What's the next bucket list thing for the doc?
Man, one day I want to meet Arnold.
Arnold Schwarzenegger. We can probably make that dream come true here at Digital Muscle. I'm the dream maker.
That man, he's just. I have his book.
Yeah.
I can't tell me how many times I read that book. Such an inspirational human being, and just his story, his life story, his speeches. Yeah. Like this man is just. He's just.
Yeah, he's lived like 2 or 3 lifetimes and influenced millions of people, right?
Millions of people. Millions of people. He's like this god to me. Like, man, he's Arnold Schwarzenegger.
Yeah, man, he's living the dream. I think a lot of people want to out there in dreamland want to meet Arnold Schwarzenegger. That might be something we can make happen. But in the meantime, we definitely want to make sure all the athletes out there know that Dr. Morales is available. Obviously, follow him on Instagram, which is Dr. Morales _. Fit Doc. And we're going to see more of you coming up here in 2021 by no stretch of the imagination. We've got some big things coming. I'm not going to reveal them all right now. Otherwise, we wouldn't be the show that we are. But we're going to come back here and visit with the doctor. And also, we're going to follow him through the 2021 season to find out what his patients think of the doctor and check out some of his before and after work with his clients. But for all you fitness athletes, this is the man right here in Houston, Texas for Dr. Morales. I'm Sean Ray, DigitalMuscle.com.